Good morning. My name is Judy Thibodeau, one of the staff members at the Spina Bifida Association, and I'd like to welcome you to the second Spina Bifida and COVID-19 webinar. How is COVID-19 affecting your mental health? In today's session, we're going to talk about how Spina Bifida may already affect how you think and feel, how these changes are valid reasons to feel uncertain and anxious, to know that we are still in control and able to remain positive during this time, and that part of taking control involves developing a plan. And throughout the session, you may submit questions and answers using the question and answer button at the bottom of your screen. Type your question in the box and submit it, and we will answer as many as we can. Those we don't answer during the session will be answered and posted on our website. Our presenters today are Courtney Wolf Christensen from Cook Children's Hospital in Fort Worth, Texas, and Lauren Burdett, from a behavioral health therapist from Rochester, New York. And each of them will now introduce themselves. Courtney?
Hi y'all, I'm Courtney Wolf. Thank you to SBA for asking me to be part of this. Like Judy said, I'm a clinical psychologist at Cook Children's. I work full-time in the urology department, and I'm the co-director of our Spina Bifida program.
All right.
Hey everybody, I'm Lauren Burdett. I want to thank SBA for inviting me to present today. I am a LMSW. I work in Rochester, New York at health center, and I am a behavioral health therapist.
So just to kind of give us a little bit of an intro. So there are valid reasons that you feel the way that you do, that we feel the way that we do. We are all going through a period of uncertainty that none of us have ever gone through before. So COVID-19 has dramatically changed how we live. We know that people with spina bifida are already at risk for higher levels of depression and anxiety, which is most often triggered by feeling isolated and lonely. And so because of that, we need to be even more proactive in terms of taking care of mental health. The other thing too is that oftentimes with spina bifida, you might have some difficulty with what we call executive dysfunction. And what that is a specific area of the brain in the frontal lobe called the prefrontal cortex. And that is responsible for helping you to do things like organize your thoughts, organize your plans, goal setting, kind of really looking towards the future and planning it all out. So hopefully today we'll be able to give you some ways to cope with all of these feelings.
So we wanted to talk a little bit about the mind-body connection. So, you know, your mind and your body interact with each other to help you function and feel the way you feel every day. So we were talking a little bit, and we thought that it might make more sense if we relate our mind and our body to thinking about how the brain is like a hard drive of the computer, and it affects and directs the rest of your body, and then thinking about how what you type and how what you download into the computer is similar to what happens in your brain when it is affected by your physical interactions. So there's reasons that you feel the way that you do, and just like what I just talked about, when you understand how your body and your mind interact with each other, you can understand a little bit more about yourself. And I think even just our population, because of everything that we have to go through, you know, every day. I think I forgot to mention I have spina bifida myself. So we are already very in tune with our bodies and our minds, I think. And so just knowing a little bit more about how that works and how each affects each other, that helps us better manage and equip our thoughts and our emotions.
So our lives have changed dramatically over the past few weeks. And one of the difficult things about COVID-19 is that it poses a real threat to our lives and the lives of our friends and families. So not only the illness itself, and unfortunately people losing family and friends to this horrible virus, but also our livelihood with the way our economy is being affected and jobs are being cut and put on hold. And so we are at a time of uncertainty, and we honestly have no idea what we can predict from the future, right? So typically when we're feeling really anxious, you're able to kind of think logically and say, does that make sense? And unfortunately, where we are right now is it's hard to remind yourself that some of these thoughts might not be unrealistic.
So just like Courtney said, our lives have been changed dramatically, and many people with disabilities, not just spina bifida, but I really think, you know, anybody that has any type of chronic health condition or disability, and really anybody right now is really feeling isolated. So many people with disabilities are concerned about their needs, such as not being heard by their healthcare providers. I think not just right now for COVID reasons, but you know, the isolation and the way things have changed right now have made it more difficult for us to interact with our team, our healthcare provider team, and take care of day-to-day things that we might normally be able to reach out to them and see them for, such as, I don't know, urology or, you know, day-to-day things, if you get a pressure ulcer, that kind of thing. So it's made it more difficult. And then if you have health home care, if you have any type of aid service, that it's made it more difficult for you to reach out to those people, possibly. Accessible transit services postponed and canceled. I know in the state that I'm living in, they have postponed a lot of the accessible transportation services right now. So it's made it a lot more difficult for people to get places if they do have to get groceries, or if, you know, you do think you have tested positive for COVID and you do need to get to the hospital, how are you going to get there? And then lastly, availability of supplies. So, you know, I know a lot of us have catheterized, so having supplies for that, having your medications, those type of things, and worrying about if you have enough, because nobody really knows how long this is going to be. They're saying May, but we don't really know for sure. The virus has a mind of its own, so to speak. So making sure that you have enough supplies is also of a concern. But the important thing to remember is that we are still in control. So, you know, a lot of the main thing I've been telling my patients that I work with is that you have to focus on right now what you can control versus what you can't control. So we can't control the virus. We can't control what other people do. So when we're going out, if we do go out, if other people aren't wearing masks and gloves, yes, it's frustrating, but we can't make those people do what they're supposed to be doing or what we think they're supposed to be doing. So keeping a daily routine that doesn't include sitting in your pajamas. So we put this together and it can be modified. It's just a template, and it will be available on the Spina Bifida website, I believe, after the presentation. So thinking about what would you do if COVID wasn't happening? So I know for myself, I wake up in the morning, get ready, take a shower, take my medications, you know, maybe mid-morning eat breakfast, meditate, stretch, midday eat lunch, go to the bathroom, mid-afternoon do something relaxing, constructive, you know, late afternoon go to the bathroom, maybe then you watch the news, and then getting ready for bed and sleeping. And I think it's important to, not just for people with disabilities and chronic illness, anybody to keep a structure right now, because there's so much unknown. and keeping a routine can help you to stay calm, not overthink things, not to catastrophize, those type of things.
So going along with what Lauren just said, so what other things can you control? So you can do what you can to stay healthy. So this is so much easier said than done, but controlling what you eat. Many of us are emotional eaters, and so in times of stress, we are constantly looking in the fridge or in the pantry, and so really trying to take control of when you're eating and what you're eating and putting that into your routine. Look for ways to stay physically active, whether that means just getting outside and getting a little bit of exercise, especially social distancing with other people, but or if you have some weights, doing some upper body stuff, whatever you typically do, try to keep at least part of that going. And then control your intake of the COVID-19 news, because it can be so overwhelming. Every channel you put on is another special, breaking news special about COVID-19, and it can really become overwhelming. So make sure you're seeking information from verified sources. So the CDC website and the World Health Organization website, we will have those links for you in our resources after the presentation. But try not to get your information from blogs and Facebook posts and some of those other things that might not be legitimate and correct information.
So just like Courtney was saying, I think it's still important to connect with other people, which helps yourself and others. And you know, I don't know, Courtney, if you've heard this in the last couple of weeks, but I've done a couple of trainings, and the people in our field have been talking about rather calling it social distancing, but physical distancing, because that talks about the physical aspect of your body and who you are, rather than socially distancing, because I think now more than ever, it's so important that we connect with other people socially, just like we're doing right now over Zoom. So, you know, I think now is a great time to reach out to a friend that you haven't talked to in a long time, or, you know, call your mom or your family members just to check in with them and see how they're doing. You know, another thing is, I do think, well, too much Facebook time and social media can be not such a great thing. I do think it's important that we use those outlets right now to connect to each other. Maybe doing something that not only makes yourself feel better, but you know, makes others feel better. So I know coloring can be like really helpful. I've seen people taking pictures of what they've colored, sharing them with other people for inspiration. So really thinking about what you can do to make not just yourself feel better, but other people will help you at this time. And then kind of going along with what I just said, seeking safe ways to connect with your friends and neighbors and maintain a sense of community. I think, you know, coloring, whether it be, you know, if you have the materials to make a mask, I'm not saying go ahead and do that, go out and find the materials, but, you know, things you can do to help other people really will help at this time. And then the other thing that's really important, I kind of touched on already, is challenging negative thoughts and thinking positively and focusing on what you can control versus what you can't control. So this picture on the slide here, I actually have in my office at work to remind all my patients that you can't control anybody else, but you can control yourself, your thoughts, you know, your choices, actions, words, reactions, and future. And I think that that's not just important to remember right now, but every day, and, you know, as we move throughout our lives. And with that, I would say, thinking about the computer analogy before, how we think affects how we feel. So when we tell ourselves, oh, I'm stuck inside, this is horrible, you know, then we start to feel horrible. So telling yourself, I'm stuck inside right now, but how can I look at this as an opportunity to grow? How can I look at this as an opportunity to maybe do things that I haven't done in a year or a couple months that I really wanted to focus on, maybe starting an exercise plan or, you know, learn how to cook, those type of things. So the other thing that's important, and I strongly encourage, is advocating for yourself when you feel your needs and rights are being ignored. I actually had a scare myself and thought that I was sick with the COVID. And, you know, I have spina bifida myself, and I was calling my doctors and asking them if I could be tested, and I just felt like my voice was not being heard. So I share that story because I do think that right now, you know, there's so much unknown. People are not getting tested, and I just would advocate for your needs and make sure that your doctors hear you. So these are some coping strategies that you guys could use, and I apologize, I can't read it because it's small and I don't have it in front of me right now, but distractions is one. So like we talked about, having conversations, thank you, Juanita. So having conversations and listening to the radio, watching television, things like that can be helpful. Another thing you can do is grounding, which is great for anxiety. I know we had a question about that prior to starting the webinar. So grounding is an excellent tool for when you're feeling anxious. So doing things like meditating, visualization, deep breathing, those kind of things can really help regulate your body and your mind to put you in a better headspace and just feeling better overall. Emotional release, that is, you know, we are humans, we do have emotions, and it's important that we feel our emotions. So it's okay to feel upset right now. This is new. None of us have experienced this before, this COVID virus. And so if you're feeling like you need to cry, if you're feeling like you need to, you know, some of us can't run, but, you know, if you're able to wheel, push yourself, move, and that helps your body to physically release some of the emotions that are going on inside of you right now. And then self-love. So with that, you know, it's important to do things that make you feel good. So, you know, for me, I like to light candles, or, you know, essential oils are also great. Just doing your nails, if you have the stuff to be able to do your nails, or giving yourself a hand massage with some lotions, just doing things to make your body and your mind feel good.
Lauren,
Mm-hmm.
will you explain what grounding means?
Yeah, so grounding is, just like I said, it's so, a lot of times our emotions get the best of us, and we can get upset, we have anxiety, we have depression. Grounding helps you center yourself. Grounding activities, rather, help you center yourself to get you in a better place so you can think clearly and feel better. So I actually have a tool. I don't know if it's going to be posted on the website or not, but it's one of the most popular grounding activities. And what you do is you use your 5 senses to identify things that are around you in your environment to help you feel more grounded. So what you do is you identify 5 things you can see with your eyes, 4 things you can touch, 3 things you can hear, 2 things you can smell, and one thing you can taste. And what that does is that, I'm sharing this example because it helps to explain, what that does is it focuses you to, it forces you to focus on those things for each one of the numbers, and it takes your mind off of what's upsetting you in the moment or whatever has you feeling the way that you're feeling. And also, it's meant so that you can kind of be attuned to the things that you have recognized and maybe didn't see before you were upset. So if you look around your room and you find 5 things that you see with your eyes, maybe your eyes are brought to the attention of something that, you know, you weren't thinking about before, and then it's got you thinking in a more positive light.
And Lauren, we will post that tool on our website.
Okay. So thought challenge. Thought challenge is changing negative thought patterns and beliefs. So, like I was talking about earlier, if you're telling yourself, I'm stuck in the house and this is horrible, you're going to start to feel horrible. Excuse me, I need some water. And then your body's going to start to feel that. So it's really important that you try to, like I said, tell yourself, how can I see this right now as an opportunity? You know, how can I see the positive here? So maybe, again, I can't go out and do the things I want to do. Instead of thinking about that, right now I get to stay home in my house with my loved ones and be safe and healthy. And this helps me prevent myself from getting sick. So changing your thoughts. Access your higher self. That's what I was talking about earlier with the coloring too. So, you know, help someone else, smile at a stranger, pray if you're religious, volunteer, we can't do right now, but, you know, doing something that is helping you to grow and help other people, not just yourself, will help you feel better about yourself and contribute to the greater good. So when we were talking about this, how we were going to present this, the idea came up of, you know, in mental health, we often do safety plans in case, you know, you're feeling not well and like you need to talk to someone. So I thought about, well, what if we do a wellness plan, a COVID wellness plan? So we put this together for you guys. And again, this will be on the website for you to use. And I think it's a really good tool for times like this. So if you are sick, and who can help you on, or who can you call on to help? Who can you reach out to if you have a mental emotional health crisis? So what we have here is, the way I designed it and I set it up is, think of a thought or affirmation to keep you centered, kind of like what we talked about with the positive self-talk. So this is a phrase that I've always kind of used: behind the storm, the sky is blue. So this virus might be happening right now, but it will pass. You know, there are brighter days ahead. Thinking about if your basic needs are being met. And then during time of crisis, it is even more important to focus on what we can control. So follow the health guidelines to keep yourself and the environment healthy. So washing your hands, wearing masks, doing those kind of things. Set limits on news and media consumption. You know, like Courtney talked about earlier, it's so important to not let yourself be consumed by the media and what they're saying right now, because that can really get you spiraling into a negative headspace, and kind of anxiety is contagious, we say. So if you're watching it and then that gets you worried, you're just going to get more worried the more you watch. Practice self-care, which we talked about, all the different coping strategies. Know yourself and your patterns and your triggers. So like I talked about the mind-body connection, lots of us know, we know when we're not feeling good, both emotionally or physically. And I would pay attention to those little signs and, you know, when you're feeling upset, and then make sure that you are doing something about it to feel better. Allow yourself to have daily worry time. Like I said, it's important to feel right now. So, you know, in the morning or whenever you want to schedule the time, I think you should allow yourself to have a couple minutes to feel how you're feeling, but make sure you set aside specific time because you don't want it to spiral out of control and consume your entire day. And then make sure that you relax and stay grounded. Moving is so important right now, being physically active, which can get your blood flowing and increase your mood. Look to your goals and values, grow. We talked about that, doing crafts, that kind of thing. Make sure you get enough sleep, recommended is 8 hours, and eat a healthy diet right now. And then we also listed who can you depend on to support you during this time. So most importantly, it's important that we look inward to ourselves to stay strong and resilient during this time. And then maybe friends and family, healthcare team. So knowing your doctor's number right now is very important in case something does happen. Reaching out to a religious community or maybe even the Spina Bifida Association. You know, I know for me, not just right now, but I have lots of friends that have Spina Bifida that I reach out to when I'm feeling down or, you know, feeling a certain way about something that happened to me, you know, in the week. And then important resource contacts, both nationally and locally. You should be able to connect to a mental health support hotline. I think at the end we will have those numbers available for you, at least the national ones. The local ones, I would suggest just going and doing a search, you know, how can I find local mental health support? I know there's lots of resources out there. Doctor or health clinic, the same thing. We should know our doctor's health phone numbers, but if you don't, doing a little research online, finding them. And then medical equipment or supplies, like I talked about before, being worried about having a shortage of those things, knowing who you can contact if you do need more catheters or supplies. And then another thing that might be important right now is knowing who you can call to possibly get food if you are running low on food. And then we would just enforce that you think about something positive and do a positive coping strategy to make yourself feel good during the day.
I'm not sure if this slide ended up in the wrong spot, but actually it's a really good reminder. So there are kind of two different things that happen during Zoom webinars. And so one of them is a chat function which has been, people have been writing, and that's been great. The other option, if you go to the bottom of your screen, it will say Q&A. And if you click that and type your questions in the Q&A section, then that kind of goes to a different spot. And we have Sarah and Judy and Sheila who are monitoring those questions so that they can turn around and make sure that Lauren and I are able to see them and that we're able to address them. So when the questions end up in the chat, sometimes they get overlooked. So what we would ask you to do is, even if you've put a question in the chat that we haven't talked about yet, just go ahead and hit that Q&A button. You can even copy and paste it right in there just so we can keep track of things. It helps us to stay more organized and to make sure that y'all are getting the information you want. We have some resources for y'all, and all of these are going to be available. Sorry, my dog's pawing at the door. Are going to be available on the website. So the American Psychological Association has a list of crisis hotlines and resources. So there's a suicide prevention line, there's a hotline if you're experiencing domestic violence. And unfortunately, what we know in times like this is that this is the point at which we really do see an increase in domestic violence episodes and child abuse episodes. And I think a lot of it is just related to us all being put in one environment under high stress and not coping with things well. But go ahead and check that resource out. And there's also a Spanish version too. The other thing that is really cool and relatively new is the crisis text line. And so this one, you don't even have to speak to anybody, which is hard for a lot of us, especially when we're feeling overwhelmed. But go ahead and just text the word hello to 741-741 and somebody will respond. And to go back to the National Suicide Helpline, it will be answered immediately. You can stay anonymous as long as you're over 18. If you're under 18, the rules change a little bit, but those people are trained to help you in the moment. Thank you so much. So there it is. So 800-273-8255. And that's if you are feeling suicidal. It's really hard to reach out in those moments. But what we know about people who have been through having suicidality and potentially attempts and all of that is that once you get to the other side of it, people are really glad that they weren't able to attempt and or complete suicide. So really reach out as hard as it is. And like I said, sometimes that texting would make things easier. You don't have to really even talk to anybody. The other cool thing, which I didn't know about until we started prepping for this website or this webinar, so it's been really cool. There is a new disaster distress helpline. And as you can see, it's available 24 hours a day, 7 days a week, 365 days a year. And it is similar to the crisis hotline for suicide. However, this is one that is more relevant if you're experiencing distress, emotional distress related to any natural or human-caused disaster, so including COVID-19. So this would be hurricanes, tornadoes, all of those kinds of things. And I know a couple weeks ago, we did a webinar, and one of the questions was, who can I call if I'm really, really stressed out and overwhelmed, but I'm not suicidal? This is the number that you should call. So 800-985-5990. And again, there's also a text option. You can text "talk with us," all one word, to 66746. And as always, the SBA has their National Resource Center available to everybody at all times. And so you can either call, there's the number 202-618-4753, or you can email Juanita, and her email is there, and ask any questions that you have. And the nice thing about this is it gives all of us a chance to make sure that we have the ability to get you evidence-based information, potentially talk to some different experts if we have to make sure that we're getting you the best information and correct information.
We have a few questions. I need to develop a plan for grocery shopping. How do you know if you are safe enough to not catch COVID?
So I think that is a difficult question. So first of all, full disclosure, so none of us on the call are medical professionals. Mm-hmm. So one thing that you could certainly do is reach out to your primary care doc or one of your specialists, especially if you have other diagnoses on top of spina bifida, to see what kinds of things you would have to do personally to keep yourself healthy. I mean, I think we can talk about just the overall general CDC guidelines that currently it's recommended that you wear a mask if you're out in public. Originally, I know it was felt that cloth masks couldn't keep you from contracting COVID-19, but the more we've learned about the illness and the virus, something that we didn't say earlier is one of the crazy things about this time is that every day information is changing. Right? And so something that we were told 3 weeks ago, like cloth masks won't help, may no longer be true. So now the CDC is recommending that you wear a mask if you're out in public. Things like hand washing, wearing gloves, again, has pros and cons. And so if you are engaging in any of these things, make sure that you are kind of thinking ahead. So if you're wearing gloves at the grocery store, you would want to take them off as you're exiting the grocery store before you get to your car. Otherwise, you're going to be touching your car handle with those gloves that you just, use to handle all of the food inside the grocery store. And so if you think kind of from a medical standpoint, anytime we go into a room where someone's in isolation, we gown up, obviously not necessarily COVID, but in general, we put those awesome yellow gowns on, and then we take them off as we're exiting the room and leave it in the room so that we're not contaminating the hallway. So kind of, you have to think ahead a little bit. But again, if you have specific questions about your health and keeping safe, the best thing to do would be to reach out to one of your physicians.
And we have some very specific medical information about COVID and spina bifida on the Spina Bifida Association website. So that will address the question in addition to what Courtney has shared. All right, here's another question. My fear is what I've heard, that if you have a condition like spina bifida or other health issues, some doctors would see me or my child as less viable and help someone else.
That's a hard one.
I think for that question, like I talked about earlier, that's why it's so important to advocate for yourself, and really using the tools that we created to help everybody today, like the plan, writing down your doctor's numbers, being persistent. Your doctors are there to help you and keep you healthy. So reach out to them. And if you feel like you're not being heard, most doctors' offices have somebody who oversees the clinic and kind of takes care of those types of situations. So just keep pushing until your voice is heard. With that said, I would also say, to be realistic and not catastrophize and kind of go to a negative place with how you're feeling, if that makes sense.
Yeah, and I think it's really hard too when we hear stories out of Italy and some of the other countries who have been dealing with this longer than we have, and you hear the horrible stories about running out of ventilators and having to choose which patients get it and which patients don't. And so I don't know if that's kind of what's triggering your question, but I would encourage you to remember that we have all of that information, and so we're really trying to, quote, flatten the curve and not overwhelm our hospital systems. And we do have a lot of extra things in place. I know I'm in North Texas, and we have an entire convention center set up with beds waiting for when our hospitals are overcrowded. And I know it's happening in different parts of the country too. But like Lauren said, those kinds of things, those are to challenge a thought like that. Like, if my child gets sick or if I get sick, is the doctor going to choose somebody over me? I think, again, remind yourself, right? So those have been really extreme conditions, and those are also personal stories from people. That's not a study that says if you have this, and this, then you wouldn't get a ventilator. Like, these are just all personal stories, and this is where we talk about making sure you get your information from reliable sources, because everybody's personal situation is different, and what's happening in one hospital may not be happening in another. And honestly, what's happening in one area of a hospital might be different than a different area of the same hospital. So everything is so variable at this point. But know that doctors want to keep everybody healthy, and they want to help as many people as possible. And they took that Hippocratic oath to do so.
And we have another question. I can't think of even coming out of my house after this. I have not left my house for a month and don't want to. I'm afraid. How can I get better?
Lauren, do you want to take that one?
Sure. So like we just talked about, it's kind of this same type of thing. Using the things that we talked about today, the whole part of the whole reason we wanted to present to you guys is to give you ideas and thoughts in terms of coping strategies that you can use to overcome some of the fears and uneasy feelings that you might be experiencing right now. So, you know, the thing that I would encourage you all is that just like with a diet, you could say that you're going to go on a diet and have good intentions, but if you don't actually put in the steps to exercise and eat healthy and take care of your body, it won't come true. So that's why it's just so important to try your hardest every day to do things to make yourself feel better. So using the coping strategies that we suggested, using the templates that we put together, calling the helplines if you feel you need that. Maybe, you know, you do feel like you do need to go talk to someone, and a lot of, I know myself and I think Courtney too, are working from home right now. So we're seeing patients from home. So there are mental health professionals out there who can help you during this time. Just because everyone is kind of at home doesn't mean that you're not alone.
Yeah, and just like Laura mentioned, using the diet as an example, you know, you could set a small goal as I'm going to start drinking even 6 glasses of water a day, right? So instead of I'm going to lose 100 pounds, I'm going to start with something small. So you could, if you haven't left your house in over a month, maybe you could kind of sit down and come up with a plan. And maybe that first step is just as long, again, as you're in a kind of safe area distance wise. But, you know, maybe you just leave your house and walk to or roll to the sidewalk, right? So small steps to get you to feel more comfortable. And I actually, while we've been on the call, I had a friend of mine send me something, and sorry, y'all, we haven't talked about this yet, but I thought it was really interesting. And it says that living through this pandemic is a trauma. And what we're experiencing is extremely traumatic. And so just a few things from a trauma specialist that I know it spoke to me. Even as a psychologist, I'm supposed to know how to deal with all of this stuff. And I can honestly tell you there are days that I'm not doing so well. So a few things to remember. So parts of our brain have shut down in order for us to survive. So when we go through traumatic events, we kind of go back to those basic needs. Am I safe? Do I have food? Do I have shelter? Those kinds of things. And when we're so focused on that, sometimes it's harder to do some of that higher order thinking. So as a result of how our brain's functioning, we're not able to fully process a lot of what is going on around us. Feeling somewhat numb and out of touch with our emotions is normal, especially if you've lived through trauma before. And trauma can be anything from, like we talked about, a natural disaster to a difficult surgery or even a difficult relationship, right? So what's traumatic to one person may not be traumatic to somebody else. Some people are also more apt to feel hypervigilant or anxious, while others become hypoactive and depressed. Neither means anything other than indicating your predisposition to dealing with extreme stress. In-depth processing of trauma happens years later when we feel emotionally safe to deal with it. And last but not least, when in the midst of trauma, just getting by emotionally and functionally is okay. So lowering the expectations and being kind to yourself and others is vital. So if you're feeling overwhelmed and you're thinking, like, snap out of it. Why are you acting this way? Why are you so depressed? Or why are you so anxious? As I'm talking to myself, think about those things and don't say things to yourself that you wouldn't say to another person. If a friend called you and said, I cannot get out of bed today. I have no interest in showering. I don't even want to eat. I just want to lay here and sleep all day. What are some of the things that you would say to that friend, right? Be kind to them. Don't make them feel bad for feeling that way. And then start using that as your own self-talk and reminding yourself that, hey, it's okay. And I know Lauren had mentioned this earlier too, that it's okay to have times of the day where you cry or stress or do whatever that is, because it's normal. We want you to feel your emotions, but also don't be too hard on yourself.
We are getting suggestions for people to look for their local advocacy agencies in your city or town or state that would be provide other advice or support. We do have another question. Do we have time, Juanita? I think so.
Yeah, I think
Do you have any advice to get someone to understand that we could be at higher risk and that they need to wear masks when they go into the community so there's less chance of bringing something back into the home?
Lauren, do
I
you
think
want?
what you said it's hard to make other people do what you think they need to do.
I just want to clarify what you guys are thinking. I think this question is asking, like, how can you help other people to do what they're suggesting from the health agencies?
Yes, yes.
Yeah. So again, we like the visual of I can only control myself, I can't control other people. You can have the best intentions, we all do, right? And you can want things, you can wish that other people were a certain way, said things, but ultimately at the end of the day, we can only control what we can control, and that's ourselves. So, you know, I think the best thing is to live by example and taking care of yourself. So making sure you're washing your hands, making sure that you're wearing a mask, doing all those things. And hopefully, you know, your loved ones, if that's what whoever posted this question is concerned about, or the people around you see that and they see how important it is, and, you know, they start to copy those actions as well. Unfortunately, that is, I think, really the best thing that you can do, because you can mention to them, hey, you know, I have a health condition and I'd really appreciate it if you would wear a mask or wash your hands or, you know, some other things. And they may listen to you and they may take your advice, but you can't force anyone to do anything that they're not going to want to do themselves.
Thanks,
And we've been getting, sorry, I'm checking the chat window, some really great information that we will definitely include with our resources, but Millie has provided us with a phone number for the Partnership for Inclusive Disaster Strategies. And she writes that it's a national hotline for people with disabilities. And so we'll make sure that that information gets to the website also. So thank you all for sharing those resources in addition to what we have, because, you know, it's hard for us to know what all of the resources are, but certainly super helpful. So thank you.
And the last slide. Juanita?
Oh, there's one more question.
Yeah, sorry about that. Yeah, I just wanted to say, I think we have time for one more question, and I'll let one of you two deal with it. Yeah. And the question was, how can you handle long distance relationships? And I'm guessing the question is given that, well, I mean, yes, how would you handle long distance relationships in this time?
You want to start, Courtney, and I'll finish with anything.
So I think those of you who have long distance relationships, whether it's friendships or romantic relationships, I think you're kind of a step ahead of everybody else at this point, because you know the extra effort it takes to be able to stay connected to somebody. And so I would encourage you to think about what has helped, what has worked in that specific relationship in the past. Is it FaceTime calls? Is it even like handwriting notes and sending them to each other? Is it texting? What is it that keeps you connected to that person? And then really focus on that and really emphasize it. And then potentially even use those things that you found to be helpful in those relationships for other relationships, maybe for somebody who may live close to you distance-wise, physical distance-wise, but unfortunately, with the way things are right now, you're not able to see them. You're not able to go grab coffee or have lunch or, you know, meet up and go to the gym or do whatever it is, but you can still use those skills Just make sure that you're staying connected. And especially if you're feeling overly anxious or sad and depressed, that's when it's even more important to reach out to those people. And sometimes when we're in a relationship and, you know, even if, so for example, a friend, like, oh, I have a friend who's called 3 times and I haven't returned their call and I'm feeling really guilty about it. And so I've been avoiding not calling. And the longer you avoid that, the more anxiety it causes you. And so at some point you have to just say, you know what, this person's a friend and they're going to understand that I just haven't either been in a headspace to do this or, you know, just been really busy with life. And so picking up the phone and calling that person or shooting a text or doing whatever it is, and you'll be amazed at how much relief of that anxiety you'll get by finally getting that done.
Mm-hmm.
And
I want to remind everyone that you will receive a link to this presentation. And so you can, it'll tell you how to go to it. All the information that you're seeing on the slides will be available to you then.
and if we have time for just, I think just one more question from someone who is coping with the fact that they're the only available caregiver for their child with spina bifida, and they themselves have severe health issues. So I think a lot of this would depend on, you know, maybe in what state they live and if there's an option for temporary home health care. But I wanted to ask Lauren and Courtney if you have any additional thoughts about how a person could cope with this stressful situation.
Go ahead.
Go ahead. I was just going to say, you know, I think most importantly, I would give yourself time and let yourself have breaks, because I am sure if you are having your own health issues yourself and then your child has health issues as well, of course it's going to be a more difficult situation. So everything we talked about today, making sure that you're taking care of yourself, you know, making sure that you and your child are doing things to keep your mind as positive and healthy as you can. So whether it be watching a movie, something to keep things light. And then I would just also include, you know, I think it's different for each state with what's available as well as how things are available in terms of the way the government is set up in each state. So I think most states have disability advocacy agencies, things like that. I would maybe contact them, or, you know, usually your health provider, like we talked about before, and that's why everything that's listed on that COVID plan is there to help get your brain, your gears going and think of contacts that you can reach out to. So a lot of times the healthcare providers have resources that they can provide for that type of situation.
Yeah, and I would, to piggyback on what Lauren said, you know, you can, so first of all, something that she had mentioned earlier, which is one of my favorite statements, is that anxiety is contagious. So you have to figure out as a parent how to manage your own anxiety, even if you're having to fake it in front of your child, to try to keep your child as calm as possible. Mm-hmm. And then the other thing too, like Lauren said, you know, using maybe that readiness sheet that she had created to kind of set things out for you so that you can really go step by step and make sure that you're, you know, looking at all of the options. And as somebody who works in the healthcare field, right, in neurology, reach out to your child's physicians, nurse practitioners, behavioral health people. There are a lot of resources out there that you might not be aware of, and especially in this weird environment that we're living in now, some of those kind of home health aids and stuff that may not have been available to you 4 months ago because of all of the ways that Medicaid and Medicare are changing in terms of what they're covering now that they weren't covering just a few months ago. It's possible that now your child would qualify for having an additional caregiver, you know, and that would at least relieve some of kind of that caregiver burden off of you, especially if you're dealing with your own health issues on top of it. Definitely a hard place to be. And so a couple of closing thoughts. So people with spina bifida have had to overcome so much uncertainty already. So y'all are faced with, daily hurdles that a lot of other people don't have to deal with. You have to make decisions about whether you're going to do surgeries or not do surgeries, just kind of being uncertain about your future and relationships. And there's so many things that y'all have to think about, but you have gotten this far and you have figured that out, and you've been so strong through all of it. And so you have that inner strength, and this was a time to reflect on that and to remind yourself about how much you've been through in the past and that you've gotten to where you are today. And then also maybe to think about, what did you do in those other times of uncertainty that you found to be helpful, because that might be helpful now.
Yes, and I like to say that we're all natural born warriors. All of us that have spina bifida and other disabilities and health conditions, and this is just one more battle that we will win. And I think the other thing to go with that is, I know myself, I have my friends and my family, but I feel so lucky and honored to be a part of the spina bifida community and have so many family members in that respect too, that I know I can reach out to at any time. So I think all of you, I would encourage you to remember those things during not just this time, but any difficult times.
Thank you. And I want to remind everyone, all the participants, if you have a specific question about your own situation, to reach out to our National Resource Center. That's Juanita, and it'll be in the presentation, but if you look on the website, you will find the connection to the Resource Center, as Courtney mentioned earlier. But some of you have some very specific questions, and we would love to have the opportunity to discuss them with you. So a reminder that you will receive a link to all of this, I think by tomorrow, probably. And then if you have questions about that, reach out to the Resource Center. And we really appreciate your being here and helping us understand this situation better.
Thank you so much for joining us. Hopefully this was helpful.
Thank you, everybody, and stay safe and stay healthy, and we'll see you on another webinar.